across the plastic.
Yeah.
Right? If we then put this new compound on there
Yeah.
and did the same thing,
Yeah.
Look back down.
as the tumour grows, parts of the tumour might break off from their original site and move around the body. And we think that BCL3 plays a very important role in this. And this process is termed metastasis. So if a patient comes to the clinic with a metastatic cancer, what has happened is the primary tumour has now started to migrate around the body. Now, having identified BCL3 as a very important gene in this process, we then turned our attentions to trying to inhibit this gene using a chemical agent.
A small molecule here, then very difficult to target protein-protein interactions because they are big, low surfaces. It induces a distortion in the BCL3 there that blocks that.
Is that anchorin repeat 2 and promotes transcription?
Right. I like that because.
But so the whole model would be the BCL3 sequesters.
Good morning. Good morning. How are you?
So what's this all about?
So we're doing a little story on the BCL project.
Oh, okay. Whatever that is.
What we've been successful in doing is taking through from studies in the biology lab through to drug design, synthesizing the chemistry lab of new drug candidates, and then testing those in models of metastatic breast cancer. We've now got to a point where we've kind of shown proof of principle that what we've designed to target the specific gene product BCL3 has a real effect in breast cancer models.
And as well, if you think about it, if you keep it on your own, a small molecule sitting on a shallow surface will be washed away from the by the water in the environment. So that's why we need more refined, defined pockets where
string then folds in on itself.
Right,
and
I see.
becomes a structure,
Like
but it looks like a ball, but it's actually made
Of lots of
of
like
a single
ball of
string.
I suppose.
It's still
yeah.
a single string, but it wraps around it. So the idea for this new potential therapeutic strategy is to, as soon as a patient comes to the GP's clinic, is to give a patient a therapeutic such as this, so that would stop the process of metastasis, this migration around the body, in its tracks. While then the surgeons and the clinicians are looking to try and treat the primary tumour, for example in the breast, then we know that we've stopped the progression of the disease to the more dangerous form of metastatic breast cancer.
So thanks to the advances in research and treatment, the good news is that the majority of women who've been diagnosed with breast cancer will survive the disease. But sadly, for a number of women, the disease will come back or spread, and therefore this research is really important. Because if this research can be translated from the laboratory into the clinic, it could provide a much needed new options of care for many thousands of women. I mean, this is actually a graph of. I'm always wary of labelling things as massive breakthroughs because often research doesn't work like that. Research is usually quite incremental, and we're all really working together and pushing in the same direction to achieve a common cause, which is to improve the lives of people affected by cancer and hopefully come up with treatments that will help them survive the disease.
Maybe we should show you our little piece that was on.